Welcome back to Local 5 Live, everybody. July is National Ice Cream Month, but if it makes you cringe because of your sensitive teeth, then we have some good news for you. The condition can be treated.
Yeah, Appleton dentist Dr. Jessica Pasono joins us now to talk a little bit more about tooth sensitivity. Good morning to you. Thanks for being here.
Thank you for having me.
So let's start by asking you, what is happening when someone is experiencing tooth sensitivity? What's going on in their mouth?
Well, tooth sensitivity typically occurs when the hard outside part of the tooth crown, called the enamel, is worn down.
Okay.
That then exposes the inside portion of the tooth, which is called the dentin. It's a little bit softer structure than the hard outside enamel, and it actually has little microtubules in the tooth that can transmit different fluid movements and temperatures to the nerve of the tooth. So that's when you start having that sensitivity, is when that dentin is exposed.
Okay.
The root structure of the tooth, when you have different types of recession or the gums start to recede, that can also expose the root of the tooth, and that can have dentin in it as well. So having recession, things like that, can also expose that dentin, creating sensitivity.
Okay, so we were just looking at some of the causes of tooth sensitivity. Let's go over some of those.
Yes, so one major one is cavities in themselves, having decay on the tooth. Another couple reasons are either fractured teeth, fractured fillings, worn down tooth structure from either clenching or grinding your teeth that can wear into that dentin substructure, and even just having plaque sitting on the teeth, which has bacteria in it, can cause sensitivity on the teeth.
There's a lot of different possibilities for why this might occur. So you got to kind of figure out what the cause is, and then does the treatment vary based on what the cause of the sensitivity is?
Yes, it does. Finding out the root of the cause is usually what helps us decide what type of treatment we're going to use for our patients. So there's a couple different options. Using a desensitizing toothpaste is a great option. They typically have potassium in them, which is found to help make the nerves not as excitable. It helps kind of plug those tubules. Another option is a fluoride varnish that we use at our office that we kind of paint on with a toothbrush, this kind of thing, and it also helps strengthen the enamel. If too much tooth structure has been either fractured away or worn away, we may need to actually place a filling or even possibly a full coverage crown on top of the tooth to help replace that missing tooth structure.
Because it can really affect your life, right? I mean, it can even hurt when you're brushing your teeth.
It can.
Okay. But it's good news to hear. I always had heard that, you know, once the enamel's gone, it can come back, but there are some other things that obviously can help make that work.
I have a little bit of an off-topic question in regards to the toothpaste, like the sensitive toothpaste. If you find relief from that, or maybe you don't struggle from sensitive teeth, is it bad to use that kind of toothpaste if your teeth are normal, or is it really not a big deal either way?
No, nope. A lot of them have all the types of ingredients that you would want normally for your regular toothpaste.
Okay. Just wondering.
All right. I was going to ask that too.
Were you really? Okay.
On the same page as usual. Let's talk a little bit about preventing tooth sensitivity, because there are some things that we can do on a daily basis, right?
Yes, there are. One of them is to use a soft bristled toothbrush. I'm a big proponent of using an electric toothbrush. They make them now that they actually have pressure sensors in them, so they'll actually beep at you if you are pushing too hard against the teeth. Which a lot of people really don't realize they're actually brushing too hard. Another way to prevent is flossing. That's always a big one. That can help prevent gum disease and periodontal disease, which can cause that gum recession and infection around the teeth. The biggest one is just visiting your dentist regularly, every 6 months, having your exam and just talking to them about your individual case and what you can do to prevent tooth sensitivity at home. That's the biggest one.
Seems so easy sometimes to put off that regular appointment, but you don't know how much you need a dentist until you need a dentist.
Exactly. Very true. And then there's no going back. All right. You got to get in there. All right. Thanks, Dr. Pasono. Nice to meet you.
Thank you so much for having me.
Let's take a look at where to find some more information on WDA.org, which is the Wisconsin Dental Association. You can find the free quarterly newsletter, Tongue in Cheek and Teeth Too. You can look on your oral health for sensitivity information, or you can find a dentist, and there's also the option of mouthhealthy.org. All right, thanks for joining us today.
Thank you so much for having me.